Good morning, everyone. Thank you for joining us for today's webinar, Next Steps in COVID-19 Protocols and Compliance, presented by Rea Associates, a top 100 regional CPA and business consulting firm with offices across Ohio. My name is Imani Fields, and I'll be moderating today's presentation. Before we get started, there are a few housekeeping items to cover. First, if you have any questions during today's presentation, you may enter them into the chat box on your screen. We will try to answer as many questions as we can at the conclusion of today's presentation. However, to be respectful of your time, we know that we will not be able to get to them all. Therefore, following today's webinar, we will review all questions and send out the answers via email as soon as we can. When you receive this email, you'll also receive the recording of today's presentation, as well as a link to participate in a very short evaluation. Please take a few minutes to share your thoughts about the presentation as a whole, the information provided, and our presenter. Your feedback is important to us as we determine future webinar topics. Also, if you'd like a copy of today's slides, you'll find that they're available in the handout section of the webinar dashboard on your computer screen. Today's webinar will be given by Renee West. Renee West is a senior manager and leader of Rea Associates HR consulting practice. With more than 27 years of experience in human resources, Renee specializes in assisting organizations with manufacturing, nonprofit, contingent staffing, food, and other industries with their HR challenges. She's also currently serving on the Ohio Society for Human Resource Management's Board of Directors as Central District Director. Today, Renee will hone in on updated regulations and policies, address common questions businesses are facing in the hopes of providing you with the guidance you need when it comes to tackling these really tough situations. And I will pass it on to you, Renee.
Thank you, Imani. Appreciate the introduction, and thank you everyone for taking time out of your day to join us for this webinar. We know it's December, and it's hard to believe that we're still talking through some of the COVID issues. We've come a long way. However, there are still a lot of updates and guidance that we want to be sure we share with each of you. So a lot of information to cover today, but specifically we're going to touch base and just review the existing FFCRA leaves that are in place currently. Talk through some timing and projected ending dates for those leave requests and how you can assist your employees with these types of leaves. And also look from an employer best practice standpoint, sharing with you some updated CDC guidelines and protocols that have come through. Also showing and sharing some scenarios with you of some common questions that we've been receiving, and also some steps that you can take as best practices as well. And also from a compliance perspective, we would like to share some details with you on how to mitigate risk for your organization as the workplace is changing with different types of employee concerns stemming from the pandemic. So we are also looking at sharing some details on some pandemic case scenarios and lessons learned and best practices. And also as talking with policies and compliance, very important as we look at handbooks. And of course, there's also a lot that we are still waiting to hear about, and further determination will be made as we move through the next month. So we'll touch briefly on those as well. So a lot of information. So let's go ahead and get started. So briefly, as everyone is aware, previously in April of this year, Congress put through the Families First Coronavirus Response Act that provides paid sick time for employees that meet the criteria of the FFCRA. And we're not going to go into a lot of detail, but I do want to be sure we do touch base for those that might not have been attending our previous webinars. So the requirement for an employer is to keep these records of these requested leave on file for 4 years from the date of the leave. And it's important that you as organizations, provide your employees with information in reference to the FFCRA. Next slide. We at the firm have developed a spreadsheet that we have shared, and this will also be one of the handouts for you. And specifically, it reviews and it can serve as the documentation for any of your employees that would request leave for the Emergency Paid Sick Leave Act. In summary, all full-time employees are eligible for 80 hours of paid sick time if they meet the criteria listed. And also part-time employees are eligible for this as well. This is a very popular question that we receive, and we have provided guidance on how to equate what that part-time rate would be. Next page, please. This is the bottom portion of that form as well. As you see, this can actually be a form that your employee can fill out. It has their signature. It has, a place for them to request the time and the date of their leave. And it also allows the HR or your manager to sign and approve these leaves as well. And on the right side of this column, on each of these pages, it shows what the type of pay should be, because it can differ based on the type of leave that is there. Very important that employers keep in mind that keeping these documents on file, you need to have them on file for any type of leave that's requested, even if you do not approve it. So that's very important and a very key piece that we want to share. So again, please feel free and utilize this form if you need us to share. We're happy to do so. But this has definitely been a resource and a great practice to keep these filed and documented at your organizations. Next slide, please. So we do just want to touch base briefly on the FFCRA leave, as you see on the form there. As you know, many schools are, either remote now or have a variance of, remote and in-person schooling going on. So there are still the eligibility requirements for employees if they need to take care of school-age children. And if you look at the bottom of the FFCRA form that we just referenced, it does share with you the eligibility criteria and subsequent pay for those employees that would need to care for a child based on those criteria. So that's important because we don't really know as we move forward, what the school system will look like. Next slide, please. And as we mentioned, this does talk through a little further about the Emergency Paid Sick Leave Act, and it talks about the specifics of the different types of criteria. And all of the information, again, that we're referencing today will be available on the attachments, and we also, at the end of the slide presentation, have provided links for you to access this information as well. So let's take a few minutes and obtain your thoughts and do a poll question. Does your workplace currently have the mandated COVID-19 workplace information posted? Appreciate your answering either yes or no, or you're not aware of the posting. Give everyone a few more minutes here. Thank you for participating in that.
Okay, so it looks like 81% said yes, 9% said no, 10% said they are not aware.
Okay, thank you, Imani, for sharing that, and thank you, everyone. If we could move to the next slide. This is actually a copy of the specific workplace poster that all organizations should have at their workplace. And you do see at the bottom there is a code you can scan, or there's a website that you can go to print this. This is the primary poster that should be at a very visible location for your employees. Most employers post this, by your time clocks or your lunchrooms. This is one that is, again, should there be updates to the regulations will change, but right now this is the main compliance poster. So if you do not have this posted, we advise that you do so. If you have questions, again, please reach out to us, but it's great to see that the majority of the employers have this posted, so that's great. Next slide, please. So as we talk through the leave request, we do just want to touch base again on, because we have a lot of questions from employers on what do we need to keep on file for our employees that request the leave. As we mentioned before, The form that we provided is one of those resources to assist with that. And it's important that even if, again, an employee is not, maybe they don't meet the criteria for the leave or there's a question, it's important that you document, and you can use that form for notes as well. And also from a payroll perspective, payroll records are separate, but it's also important that you keep this documentation in reference to any leave request in a separate folder from the personnel file. So that's also very important. You're required to keep this on file for 4 years. So be sure that you have that separated. Next slide, please. And actually, if we could back up, I'm sorry, can we go back to the previous slide one more time? Another very common question that we are receiving and we're hearing from employers is, what should we have the employee bring us? Right now, if they're coming in and saying, I'm sick or I have a positive test, there are a lot of different types of excuses that might be out there, or different parts of documentation. Right now, it is very challenging for doctors and organizations to provide these excuses because of the backlog of appointments and testing results. So it is challenging. So we do recommend that you try your best to obtain what you can from the employee, but also keep in mind that they might not have access to something right away due to the timing of the testing, et cetera. Next slide, please. So as we talked about, the CDC, as you know, continues to update guidelines as we move through the pandemic, and most recently had changed and updated the definition of what they feel close contact should be. So this helps us to determine in the workplace if in fact an individual has been in contact or close contact with someone. So basically they've defined the close contact as being within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period, starting from 2 days before the illness onset. Previously, the guidance was for 15 minutes at one given time. So that has changed, but it's important to know that this is the new definition, and we wanted to be sure that we do share that. Next slide, please. So we also have some updates from the CDC, and this is the federal guideline that as of yesterday, it is currently being rolled out, and there are a lot of questions surrounding this and a lot of questions from a state level as to whether states will be following this as well. But the recommendation as it stands right now is the CDC is reducing the recommended days a person must quarantine after exposure to COVID-19 from 14 days to 7 or 10 days. And again, this guidance was announced yesterday. And again, reviews those that have had close contact with an infected person can end their quarantine after 7 days if they receive a negative test, or after 10 days without a test. So keep an eye out and stay tuned, as things tend to move forward with this. This was, of course, in the news yesterday, and more than likely will be put into play here very soon. So this is just based on guidance, and I know a lot of people I've talked to have questioned whether or not that's safe to do that, but also it does help to decline that time that an individual is away from work as well. So again, just for your information, and stay tuned for that as well. So we've also, as we've moved through the last couple months, employers are questioning, what are we supposed to do if an employee becomes ill? What happens if, we're at work and an individual is exhibiting symptoms, and there's just so many questions right now that we don't know. Does the person have a cold? Are they actually sick? The CDC recommends that, employers take action of, any employee that has symptoms when they arrive at work, or become sick during the day should immediately be separated from other employees and sent home. It just makes sense. It's, we're hearing right now out there that a lot of different employees and people feel they've always had allergies, or they've always had maybe, colds this time of year, and are coming into work and thinking that's what they have. However, they actually test positive for the virus and then have, infected others around them. So as a best practice, sick employees, should be sent home. Also, requested if that remote work is available for them to, work from home as much as possible, and follow the recommended steps and guidelines. And again, we've highlighted the CDC site that does provide information in reference to what those steps should be. And as I tell, a lot of the people that we talk to, if employers just err on the side of caution, it's best to, if a person does not feel well, we've even had, some people I've talked to where they don't have any symptoms at all, and say that they feel well, but you just have to watch each situation and monitor it as best that you can. And also, if you have questions, utilize your local health department as well. Next slide, please. And as we talked about, so, what steps should you take if you as an employer have an employee that tests positive for COVID? In most cases, you don't need to shut your facility down. Utilize your local health department as well as a resource. They are the individuals that are conducting the contact tracing and, assisting employers with notifying those that had close contact. As an employer, you can have protocols in place for you to notify others within your organization if and when an employee tests positive, however, not sharing the name of that individual, but letting them know that there could be close contact and that they could be needing to quarantine as well. And also follow the CDC guidelines as well for, cleaning and disinfection also. And, as part of the process for employers, so you have an employee that tests positive, that also immediately qualifies them for that FFCRA leave that we talked about. So being sure that you have a step in place to let that employee know, okay, we do have, pay available for you. Here's what it looks like, because there's a lot of questions surrounding, that if they are going to be off work. This is another very common question that we're receiving. And again, we're referencing back to the CDC recommended steps. If an employee has been exposed to the virus, but not showing any symptoms, should they be permitted to work? And as you see here, for the CDC, if they've been exposed and are in close contact, as we mentioned, being within 6 feet of a person with a total of 15 minutes or more, then that suffices as that close contact. Potentially exposed employees who have those symptoms should isolate and follow the recommended steps per the CDC, and to follow the quarantining timeline that we do have in place. The biggest thing that we're hearing from employers and the concerns that we're hearing is the employee says, hey, I know I've been exposed, my husband has it, or, my daughter has it. I'm fine. I feel fine. I don't have any symptoms. I want to come into work. That is a challenging conversation for employers to have. Even though an employee might feel well, they still could have the virus. So, ensuring that they monitor and follow the CDC steps is very highly recommended. Next slide, please. So we've shared here, this is a resource, and this will also be available for you to print. What happens if you have someone that does test positive? What are they supposed to do? What do you do? And this is a reference from the Ohio CDC that just talks through the best practices. And there's more than one page on this, but we at least wanted to offer this as a resource. And it's nice to have as well to point your employees in the direction. If they have questions, they know where to go as well. Next slide. So let's talk a little bit about, as you know, with any type of employment situation and things that tend to happen. I mean, this is our first pandemic, obviously, that we've been through. It also creates workplace concern and issues where it can open up the employer for potential risk if certain types of protocols and policies are not followed. So we're sharing some pandemic scenarios that we've compiled over discussions with our SHRM group and different contacts throughout the United States that are seeing these trends that are starting to appear in the workplace. We want to share some resources for you on how to help mitigate risk to your organization. So the first one that we've heard a lot of discussion on and are seeing some increased concern with is inconsistency in administration of remote work procedures. So some companies, for the most part, a lot of companies did not have a remote work policy in place before the pandemic started. So trying to, possibly offer that and trying to deal with being consistent in that process. For example, what we have started to see is groups of employees are claiming that the remote work was maybe only offered to certain types of individuals, maybe younger individuals versus older individuals. There was just no consistency in how that remote work was being scheduled. So later on, as we go through this presentation, we'll talk about some resources about how to help have a policy in place specifically for this. Also, as a result of the pandemic, there was a lot of furloughed or laid off workers as well. And again, employers were just forced to, make very quick decisions. And there needs to be a consistent process in place of how that is being done, especially as the economy improves and individuals are being called back into the workplace. There's been some inconsistency in how workers are being recalled, so it's important that you have policies in place to look at how you're recalling workers. There's been some cases where organizations, were said to only have called back younger workers versus older workers, or only brought back certain individuals. So again, that laying off and that furloughed workers, you need to have a standard policy for that. Also, a trend that we're seeing is the deals with the Americans with Disabilities Act. And there's a lot of, and again, we are not lawyers, so we are not giving legal advice, but there tends to be, some increases now in, denial of flex schedules that individuals might be asking for, where employers deny it. However, it should have been considered because it was actually a disability under the ADA. So as an employer, just being sure you're aware of the ADA Act and the provisions within that can help mitigate that risk for you. Next slide, please. Another interesting one that we're hearing of is laid off employees that are rehired in different roles and earning less. Again, it's important when individuals are being brought back into work, if they are rehired, that your organization is looking at those protected classes and looking at the process of how you're rehiring and ensuring that there is no disparity in any type of that process. Also looking at reduction of work hours. Again, employers were challenged with having to, manage work and stretch work for their individuals. So reduction of work hours and, not being consistent in how that's done opened up a lot of companies for risk as well. Some companies implemented task force teams to help with the pandemic. And, I know at our firm, we implemented that and it has been very helpful. We do understand that, task forces can be applied for any type of organization, but they do caution to ensure that your task force is diverse as well. And the biggest one that we're seeing now is, the FFCRA leave, continued concern where some employers not offering it to employees is regulated, which is, starting to move towards some potential lawsuits there. And I always tell clients that the internet has a lot of information out there, and your employees are very well versed in what their rights are. So it's important that you as an employer know those rights as well. And if you have questions, utilize those resources to help you as well. So as we talk through employee handbooks and policies, how can we, all the pandemic scenarios that we just talked about, how can we help to mitigate risk to your organizations, and what should we have in place? This is something we consistently talk about on our webinars and the importance of them. And updated policies right now, of course, should include the FFCRA leave. And we know that this leave right now is only in play until December 31st of this year, unless there is continued unless it's continued. So we'll talk about that a little further. So we do recommend that, the FFCRA, even though you can have these policies, are just separate from your handbook because of the timing of this, but definitely a piece that you do want to have available for your employees. Also looking at your travel, that is definitely something, your travel policies, especially those states that, might have employees traveling to high incident states. What is your organization's policy on travel, and keeping up with that as well. Next slide. So we also talked about policies as they relate to, the pandemic and emergency preparedness. None of us obviously would have thought that we would be going through a pandemic. So that's really given companies the opportunity to structure policies and procedures to help in the event that, there's a workplace issue or another emergency, there's a fire or something that really would be an emergency. It's important to have this information there. Attendance is one of the biggest areas right now where we're seeing questions, and having a standard attendance policy in your handbook is very important from a consistency standpoint. It's also important, especially now with, individuals that are off on, they might be off on medical leave or off on FFCRA leave, ensuring that your attendance policy has leave of absence sections in there, and that you're consistent in how this attendance policy is administered. Very important to have that in there, along with the paid time off. Paid time off could be personal time, paid vacations. So how is that defined, and how is that utilized in conjunction with your leaves? So if you have an individual that's on, an extended leave of absence, how does that impact their paid time off? So having all this defined is very important in your handbook. Remote work policies, as we talked about, is one that organizations are looking to add or revise due to the increase in the remote work. And again, very important from a consistency standpoint that's provided. One of the next ones that we want to talk about is the workplace violence and the safety. As you know, right now, employees, yourself, everyone is going through dealing with a lot of uncertainty. There's a lot of stress, can be financial, can be family, can be concern with your children. A lot of that is coming into the workplace, and people are very stressed right now. So workplace violence and having a policy of keeping your employees safe is very, very crucial right now, as organizations are starting to see an increase nationwide in just workplace violence. So it's important that you keep your employees safe, not only during times of the pandemic, but at all times from any type of workplace violence. Next slide. So let's take one more poll question. If you could, we're curious as to what do you feel is currently the top COVID employment-related lawsuit being filed by employees? Is it due to safety? Is it retaliation, whistleblowing, or relating to leave of absences? Thank you for taking time to answer this.
Okay, so it looks like 40% said safety, 9% said retaliation, 7% said whistleblowing, and 44% said leave of absences.
Great, everyone. Thanks, Imani, and thank you for sharing that. And so the answer is the top one right now is safety related to COVID, and the second one is the leave of absences. So as you see, those are definitely prevalent not only in the state of Ohio but through the entire United States. So it's important that you keep those things in mind. So as an employer, you wonder, I've had some ask me, what else can I possibly do from a safety perspective to ensure that we're doing what we need to do from COVID? And that recommendation is continue doing what you're doing. Utilize the CDC guidelines and protocols, face masks, the social distancing, the cleaning of your workplace, the availability of hand sanitizer, sending employees that are sick home. Continuing to do what you've been doing is very crucial, and continuing to provide your employees with communication as to what you're doing is also very important. Early on, when the virus first started, there was a lot of information out there, and then as summer progressed, individuals maybe got a little bit lax and we didn't talk about it as much. And now that we're in another surge, it's just important that you continue to enforce with your employees that you do have protocols in place to keep them safe. So as we talked through earlier some pandemic scenarios, we definitely want to just share with you some trends that we're hearing as COVID-related employee lawsuits, not to scare everyone, but again, just to be sure your policies are updated and that you have these items on your radar as we move forward. One of them specifically is with the Fair Labor Standards Act and how you define overtime pay and in your organization, ensuring that overtime pay is compensated at time and a half for hours worked over 40. It's important to have that in there because it's the designation of how that overtime is paid. Specifically now, if you have employees that are off on leave and might not work a full week, how does that quantify into hours worked? So it's important to keep that in mind. Job classifications is another big area. So looking at, do you have hourly employees classified correctly? Are salaried exempt employees, are they actually exempt? Are they performing exempt duties? So ensuring that you have people categorized correctly from a job classification standpoint. And we also talked about earlier the Department of Labor and looking at the reduction in workforce. And anytime that there's a reduction in workforce, obviously some organizations of a certain size, are required by, the WARN Act to make notification of any type of reductions, but ensuring that moving forward, you have something in your policy that states the process of if and when you were to need to do a workforce furlough or layoff. Very important. Next slide, please. Oh, so we're going to throw another poll question in there real quick here. As we talk about all these policies and all these questions, let's look at your handbook. So has your employee handbook been updated? Yes, no, or not sure? few more minutes here. This is the last poll question, by the way. Thank you for participating in these.
So it looks like 36% said yes, 55% said no, and 9% said not sure.
Okay, thank you, Imani. Thank you, everyone, for completing that. And again, just very important that employers have these policies and your handbooks updated. We are a resource to help you with that as well. And I always say it's best to have a policy and procedure in place before an incident that requires that policy happens. So it's just the best practice. So we want to spend our remaining time before questions talking about what is still to be determined and what is out there that we just don't know yet as it relates to COVID and all that contains COVID. So as you know, right now, the pandemic unemployment assistance was put into play earlier this year. And, that in addition to the FFCRA benefits that we talked about and the leaves are currently set to expire December 31st of this year. So right now, we are awaiting Congress's decision to either extend the FFCRA benefits and the unemployment or make modifications to what currently is there. What are we hearing from an HR perspective is, given the surge of cases still throughout the United States, we're hearing that more than likely there will be some form of extension of these benefits. We don't know that for sure, but that's what we're hearing. Also looking at the stimulus relief package, and as Congress meets and talks through options for that, what will that look like for potential stimulus checks and further assistance for organizations as well. So a lot of this right now is just up in the air. Our recommendation and best practice is, if you have employees that are questioning what's going to happen with this, just say at this point we're still monitoring it, and we as a resource will continue to provide updates on our firm's website, our COVID website, and also expect to do additional webinars too as we move forward. So as part of that as well, vaccine availability, that's going to also impact the workforce as well. And, again, and uncertainty, there's some positive news there. But right now, I think, most individuals are just concerned more so with the workplace and, the benefit extensions, that if cases continue to increase, how does that affect, individuals and their ability to receive pay? So we do expect a lot of movement here over the next couple weeks to the early part of the year, and with the new administration as well, there will continue to be updates to existing policies and some reform as well. We know that we've shared a lot of information with you. I do expect there are quite a few questions, so we wanted to share some resources with you here that we've listed on our website here. These are a number of resources for you to use. The governor traditionally speaks a couple times a week as well, and I know he is speaking this afternoon in reference to updates on cases and where they stand. There are a lot of resources out there for all employers. We also highly recommend, if you have questions specific to your area or your county, to utilize the Ohio CDC site. There's a toll-free number there, and then there's also resources at your local health department that have partnered with some agencies too that are free resources for you if you have questions. As you know, they're working very hard to keep up with everything, but there are resources out there for you as employers. And if you do have questions that, you feel free and reach out to me. My contact information is on here as well. But at this time, I'd like to turn it over and answer a few questions, if we have any.
We do. We have quite a few. So the first question we have is request forms aren't being completed. I'm documenting as much as possible. CYA, thoughts to convince management to require them.
Okay, so thank you for that question. As long as, you as the employer are taking notes, and the best that you can do is document what you can. To make them fill out the form, obviously it's not mandated by law that you have to have that form, but it is very helpful for you as the employer, because just say, for example, if there were to be an audit down the road where they would need to see how much time was paid to this leave, and if you don't have a form, or you don't have an employee signature, or you don't have that documentation, that can cause some issues. And I think the biggest part in that best practice to the leaders of the organization is, it doesn't have to be an extensive form. It's just one that we just need to have to help keep us compliant.
Awesome. So the next question we have here is, if a school is closed for reasons other than COVID, i.e. Christmas break, does EPSLA/EPSL not apply unless the caregiver is unavailable during school closure during Christmas break due to COVID, correct? And let me know if you need me to repeat that.
So if I could rephrase that, I believe the question is, if it's during Christmas break or a holiday break, does the leave apply?
I believe that's the question.
Okay. So no. As far as anything that's already in existence, paid time off, vacation, paid holidays, if those are already previously scheduled, then the FFCRA leave does not apply.
Cool. So the next question we have here is, what if an employee lives with a person who is sick / showing symptoms? Should they stay home / work remote?
The CDC recommendation, is if that individual is in close contact, which obviously they're living with that person, so I would think that would meet that criteria, that they should follow the self-quarantine guidelines that are listed on the website.
The next question we have here is, based on the CDC's new 7-day guidance, can employers instruct employees suspected of possible contact without symptoms to take a COVID-19 test following 5-day / last 48-hour guidelines to enable them to come back after 7 days of quarantine? Guidance documents have not been updated as of yesterday afternoon.
Right. At this point, we don't expect they'll be updated, because they're still working through all the specifics of everything. From a best practice standpoint is requiring that an individual have a negative test to the best of your ability to ensure the safety of your workplace is what's recommended.
So the next question we have here is the FFCRA an employer tax credit or reimbursed wages? I missed the part about sending a staff member home sick. Does that trigger FFCRA approval, or do they qualify once they seek a medical diagnosis?
So that's a two-folded question. So to answer the first section of that, yes, there are tax credits that are available, and we can defer that to our subject matter experts within Rea if you have questions. Documentation of that, is part of that process too. So we're happy to make that connection for you. And the second part of that question, could you repeat that, Imani?
Yes. So it said, I missed the part about sending a staff member home sick. Does that trigger FFCRA approval, or do they qualify once they seek a medical diagnosis?
The guidelines currently state that if they meet the criteria based on medical care, or if they know that they're around someone that has close contact and they've met those criteria, that would trigger that FFCRA, but they would have to meet one of those 6. So feeling that they don't feel well will be triggered, that FFCRA is triggered if and when they go for the testing and they have a medical reason to believe that they are sick.
So the next question we have here is another FFCRA question. It says, is the FFCRA mandate for companies with over a certain number of employees, or is it all employers?
The current mandate has, it's for employers up to 500 employees.
Okay, and then another question off of that is, how does that work with CDC guidelines?
I'm not sure I understand that question.
So it says, how does FFCRA work with CDC guidelines? I don't know. That's pretty much all the all the clarification I have with that one.
So, the FFCRA is I'm not sure I understand that question further, but I think the thought is, how do those work together? And the FFCRA is a federal regulation that applies, again, to all employers. There are some exempt employers, healthcare industry, etc. I would advise that individual, you can look at the Department of Labor website on COVID, and that's actually referenced on our slides here, and that will provide some additional information.
Awesome. So the next question we have here is an employee entitled to emergency paid sick leave if they have been exposed to someone who has tested positive, but the employee's healthcare provider advised them they do not need to self-quarantine unless they hear from the health department?
I am hearing that is very common, yes. So now we will caution that we're hearing that the health department, obviously, with the caseload of testing that they have, at times is unable to let an individual know of their result within, it could be a couple days. So I do know that health department, is the one that will let them know if in fact they need to quarantine.
Great. The next question I have here is, if an employee's family member is waiting on a test result, should they be sent home? If so, are they covered under FFCRA?
If I could rephrase, if I could hear that one more time, please.
Sure. It says, what if an employee's family member is waiting on a test result? Should they be sent home? If so, are they covered by FFCRA?
So the best practice is, they can await the test result at home. And they do, if they meet the criteria. So if they're told by the healthcare provider to quarantine until they know that result from their spouse, then that would allow them to meet that criteria for that leave.
Great. The next question we have here is there justification for going above and beyond CDC recommendations?
If I could, my understanding of that question is, as an employer, if they decide to provide more of a quarantine time or stick to what the existing one was, should they change that for sure? The employers have the ability to take care of their employees the best that they see fit.
Awesome. The next question we have here is, will the FFCRA be extended past 12/31, so December 31st?
That's the question of the day. From what we're, that is one that we're, again, waiting to hear back from. It will depend on, the Congress and what their decisions are. Again, as we, mentioned before, we are hearing from an HR level that, again, due to the case spikes federally, I would find it hard to believe that they would not at least do some type of extension, but I don't know that for sure. We just have to wait and see.
Oh, here's another good question here. What are you seeing about companies requiring vaccine when available as far as continuing working?
That's a great question. I was actually talking to a colleague today about that, and we do expect that as the vaccine availability, is rolled out and processes behind that, we do expect, legislation and some protocols and best practices for employers to come from that. I don't expect that to be anything like right immediately, but it is on the radar. And so that, again, is one that we'll have to stay tuned for, but that's a great question.
Awesome. Another question that we have here is, what are people doing for holiday travel policies? Embracing new CDC quarantine period if people travel, waiting to see what state/local does in respect to quarantine period. Ohio has had a list of states recommended not to travel, and now Ohio itself qualifies.
Right. That's a great question. It's a very common question, especially, over the holidays. Organizations have the ability to obviously follow from a federal standpoint of those, high incident states, and, can, make provisions for, their employees, set expectations that, should you decide to travel to those high incident states, that, for example, we request that you quarantine for 10 days. An employer can put in a policy to do that, but they also need to be very consistent in how they administer that, if that's what their choice is.
Right. The next question we have here is, for FFCRA, if our normal work week for my staff is 36 hours full time, so 72 hours biweekly, is their max amount of hours 72 hours, not 80 hours, since we do not work 40-hour week?
That's a great question. So you would just pay based on what your traditional work week is.
So the next question we have here is, if holiday falls within quarantine, do they get the holiday pay and the COVID-19 pay?
So that's a great question. Also a very common question. So as it stands, any existing holiday pay, vacation pay, scheduled pay that's already in existence would take precedent over the COVID pay. Now, a company might have a policy where they say an individual needs to work the day before and the day after a holiday to receive holiday pay. So that would be a different situation. It would be based on what their policy is.
Great. So the next question here is a little bit of a long one. So if you need me to repeat it, just let me know. So it says, just to clarify, just because the CDC says to do a certain number of things for workplace safety and stopping the spread, it does not mean that it qualifies as leave, not affecting their accrued paid time off. The employee would still need to take accrued paid off until one of the items from the FFCRA reasons for it not to be time off without using their accrued leave. It seems employees think everything should count towards FFCRA. So let me know if that makes sense, and if you need me to repeat that. It's more of a statement, I believe.
Sure. So thank you. I think, my understanding of that question is, can employers require employees to take paid time off before they can take accrued leave, or before they can take sick pay? We're not legal advice and legal counsel, so my recommendation per the policy is, unless they meet the criteria for the leave, if it's not paid, if they don't receive pay at the beginning and have a waiting time, if they have accrued vacation or accrued sick time that they want to use, then they can do that. But they cannot take both.
Okay. So the next question we have here is, when an employee who is required to quarantine and they are able to telework, are they eligible for emergency paid sick leave?
If based on the guidelines, if an employee is eligible, if they can complete their normal duties as assigned on a remote basis and the company has approved that, then they should just receive their normal pay and not receive the leave.
Awesome. And we're getting to the last question here. So if you guys have any more questions, be sure to enter them into the chat box. But the one that I have here is, if an employee chooses to travel when a quarantine policy is in place and the person gets sick, do they still qualify for FFCRA?
Based on the regulations as they stand, yes.
Okay, and did you have any last thoughts, Renee, just to give us some time for any
Sure.
last questions that come in?
Thank you. And I really appreciate everyone's questions. I know there are a lot of different scenarios and still some gray areas out there as it relates to this. And, continuing to reach out to your resources, reach out to us if you have questions. Stay tuned for updates as we continue to move forward through the next month. And we will share information as quickly as we can to get that in your hands and be sure that you're updated as well. And we also want to take this time to wish everybody happy holidays as well.
Awesome. Thanks, Renee. And it looks like that may be it. So thank you guys for joining us for today's webinar on next steps in COVID-19 protocols and compliance. We hope that Renee was able to provide you with some valuable insight that will help you make sense of the current government recommendations stemming from the COVID-19 crisis. If you sign off today and realize that you have additional questions, you're always welcome to reach out to Renee directly. You can also contact any of our REA team members by clicking on the People section of the firm's website at www.reacpa.com. Don't forget to watch your inbox for an evaluation survey, access the recording of today's webinar, and more. Thank you, and we hope you guys have a great day.